Hello, everyone. My name is Ryan Ebor, and I am here today on behalf of the marketing team with School Health. Thank you for joining us today and participating in our Pandemic Procedures and Protocols webinar. Today, we'll be discussing how schools are adapting and changing as COVID-19 protocols have evolved over the past year. And we'll take a look at how temperature screenings have complemented health screenings. As we start off today's webinar, we'll hear a presentation from Dr. Scott Lillibridge, who is the Senior Medical Officer and Director of the Emergency Response Operations for the Americas for the International Medical Corps. After we hear Dr. Lillibridge's presentation, we will have a discussion between Dr. Lillibridge and Dr. Raymond Hype. As many of you know, Dr. Hype is a member of our team here at School Health. He holds a PhD in Educational Administration, and before joining us at School Health, he had a long and distinguished career working in various roles in schools from teacher to administrator. After our panel discussion, we will then open the webinar to questions from the audience. We will not be taking audio questions, but you will be able to submit your questions at any time through the questions interface in GoToWebinar. You can submit questions for either Dr. Hype or Dr. Lillibridge to answer, and we'll do our best to get answers to as many of your questions as we can. Before I turn the time over to Dr. Lillibridge, I would like to review a few quick things about today's webinar. As always, the webinar will be recorded, and a link to it will be posted on the schoolhealth.com website, and we will email the link to you for future playback. Everyone who attends today's webinar will also be receiving a certificate of attendance for joining us today. You should expect to receive that certificate by email later this afternoon. And lastly, if you are having technical difficulties with the audio or visual portion of today's webinar, please contact GoToWebinar directly at 855-352-9003. Again, the number for GoToWebinar is 855-352-9003. Now I will turn the time over to Dr. Lillibridge.
Great. Can you hear me all right before I launch into
Yes.
the presentation? Thank you so much. Well, first of all, it's a pleasure to be here and share this time to talk about a couple important features. Let me just tell you a little bit about International Medical Corps and how we got involved in communities and school health. Over the past year and a half, we have been in New York, Detroit, Chicago, LA, South Texas, Boston, Puerto Rico, at each of these surges on COVID as we began putting in both medical and public health strategies. So it's been a busy year and a half for us. So it's a pleasure to be here to actually have a time to sit down with you and share some of the experience and to elevate this discussion on temperature monitoring and other types of monitoring. We'll have time today to engage in other things and take some questions, everything from vaccine to where is monitoring going in the future, and share some of the angst that people have had during the COVID response in the United States. Next slide, please. Let me just share a little bit about what we're going to cover today and on our temperature monitoring. First of all, we're going to talk a little bit about the history of temperature monitoring, how it's used in disease control strategies, patient monitoring, and some of the public health issues of fever monitoring or temperature monitoring and screening that have come up both domestically and worldwide, and how this is being used and how it is changing over time. Why is monitoring important? It's important for a number of reasons. There are direct correlations to health outcomes, health input in terms of screening and trying to shape up where a patient's potential risk is based on temperature, respiratory rate, and a lot of other vital sign information. I will consistently during this presentation try to keep a clinical and public health perspective on monitoring. There's lots of other reasons that we monitor, but for today, I'm going to say really on the clinical issues related to that, and sort of hone in on some of the public health issues that we've had to deal with during the last year and a half related to monitoring for COVID. Next slide, please. This is kind of interesting for me. One is that if you look at the picture on the left, you see a mercury thermometer. And if you're under 20, you may not have ever seen a device like this. I have young health providers who speak to me and ask, how does this work? Why would anybody wait that long? And who has time to wait 3 to 5 minutes or a period of time to, and if you didn't shake it down, it didn't work. At any rate, historically, it was really in the mid-1800s before people really were convinced that temperature monitoring was important to medicine and public health, and that investigators like Carl Wunderlich finally was able to convince the medical establishment to include this in patient charting, and it became part of public health screening, and eventually, and today we find that temperature screening and monitoring is widely useful in a number of areas. First of all, we have new technology. This day we have infrared, we have no-touch technologies. These are brand new. Over the past 20 years, they've been perfected, and we are seeing a wide range of applications, handheld and stationary monitoring for crowds. We are also aware that if you've been following this issue over time, that continuous monitoring has been something that we're looking at to get a better picture of where the patient is, or what the eventual outcome of a disease might be, or for early detection and so forth. And we found that linking things like temperature to other items like pulse and respiratory rate and oxygenation can give us a great way to track patients both before they get sick and after they're released from the hospital. So that this started out as a solitary vital sign, got into medicine, now is linked, and now is used widely in clinical and public health measures throughout the world. Next slide, please. So we have a number of modern uses of temperature testing, and measuring a person's temperature is still important in medicine. There are lots of things that we do in medicine. We take complex histories, we read the public health reports to see what's circulating in our neighborhoods, but when it comes to managing an individual patient, vital signs are still important, and key among those vital signs are temperature taking. Still stands the test of time. Many diseases are associated with changes in body temperature. You only have to have kept a sick child at home to realize that when the temperature's up, the child has something going on, and that these are tried and true relations to physiology and health outcome, particularly in monitoring patients based on temperature changes. It's a measure of effectiveness of treatment. Those who have spent time in hospitals or nursing folks by the bedside or doing house calls and all those things will realize that effective treatment often is associated with a decrease in temperature for sick patients. And you can ask any parent that has kept a sick child at home, when the fever or temperature goes away, you're looking at a child who's in a recovering phase usually. So in closing on this, fever is a reaction to disease-specific stimuli. Both viruses and bacteria and all sorts of childhood-related illnesses have predictable fever spikes that we can track and follow. Next slide, please. Let me drill down a little bit and kind of get into some of the issues we've been talking about over the past year and a half. We're trying to put temperature monitoring in with public policy. We're trying to decide about opening and closing schools. We're looking at crowds. We're looking at managing commerce. A lot of this has to do with not only what's going on in the community, but results in how we effectively do screening at places of entry. Individual patient monitoring with regard to temperature is still highly targeted and highly specific for an ill patient. I will add with the caveat that many illnesses have a wind-up period where a patient is not yet sick or having fever, but fortunately most of those, they're also not as contagious as they are when they're febrile or have a fever. So on the individual level, temperature is fairly specific, highly targeted, and really quite useful. Now let's talk about mass screening for just a minute. You know, my first big encounter with mass screening was with SARS in China in 2003, 2004, where we began looking at airports as people came and went, and public places and so forth, and tried to use infrared screening to get mass screening. That was not as useful as individual modalities of linking screening with highly detailed histories to ask questions of, were you exposed, do you feel well, and so forth. And what we see as mass screening in the United States is really given way to a sort of a combination of screening at points of entry with a questionnaire, and that is specific for this illness. There are other illnesses that we have been involved with where screening for temperature is really, of the mass is really quite important. Other diseases that are fairly serious, such as Ebola and our work overseas, highly specific to look for people who have both exposure and histories of fever, or who present with fever. And that screening tool is part and parcel of screening for that disease. So the take-home message with mass screening really is it depends on the illness you're looking at. It depends on the public health strategy you're employing. And often it also relates to specific disease at hand. So often I get asked, is mass screening worthwhile or not worthwhile? The caveat is it just depends. Next slide, please. One of the key topics at this time, obviously, is COVID vaccination and the effect of opening and closing schools. How will it affect students? How will it affect our work, our daily workplace, and so forth? And there's a couple things that we can relate to students and schools. First of all, it will certainly affect return to school types of decisions. Let me give you a kind of case in point. A highly vaccinated group in a community confers some degree of herd immunity, and COVID circulation is vastly reduced. Let me give you some examples of this that we've seen clinically. While it's early and the scientific papers aren't out, we do know that with our touch points in hospitals and around the country, that the current load and burden that we're seeing in hospitals, particularly severely ill patients, are really among those who are not vaccinated. So the early data looks pretty good that vaccine is highly effective in doing what it was advertised as reducing the severity of illness, slowing down perhaps the transmission, and helping us return back to normal activities. How will this affect the school workplace? If you can stop COVID from circulating in your community, then your risk from children or transmission is vastly reduced for everybody, and so forth. And once teachers are vaccinated, then they would fall into the same pool of those who are vaccinated in terms of added protection against COVID. Monitoring procedures may change with increasing rates of vaccination and control of transmission in your neighborhood or your local community. For example, we can move from mass screening into highly individualized screening. We can push that screening off to the home and ask parents to begin screening children who are sick and keep them at home. It will certainly affect strategies to reduce the transmission of disease as we begin to think about how we approach sports and entry back to school and so forth. And I will add that while we're beginning to vaccinate children 12 and older, that there is significant research going on today to increase the range of vaccination to include children. And also, lastly, it will reduce the burden of environmental disease control. Everybody who's been around restaurants or schools and organized workplaces with screens and excessive cleaning and doing all the environmental things that we can do to increase ventilation and cleanliness, there's an expense to that. There's a burden of activity. And with vaccination, control of the disease, a reduction of transmission in the community, we can reduce these environmental controls safely. Next slide, please. So what are some of the trends in temperature monitoring? This is important, and I want to circle back and talk a little bit about some of the new technology. Medicine is moving to disposable, non-contact temperature monitoring. There's no doubt that we're probably never going to return to the old mercury thermometer. What we're going to see, on the other hand, is an increasing array of new point-of-care technologies that allow us to take temperatures, to begin to record health events, and to be used in screening in all kinds of manners. For example, touchless kinds of temperature monitoring devices can help us reduce the burden of changing gloves, can reduce the amount of work we need to do in terms, it can speed up processing and so forth. And I also want to get back to the point that I mentioned earlier, that we are seeing the teaming up of different types of ways to look at vitals, and realizing that with a little bit of a history and temperature and a few other questions or bits of data, we can really begin to look into the future about who is really going to be sick, who might be contagious, who needs to stay at home, and so forth. And if we can push that out and start that at the home and with a greater awareness, I think we'll see less burden in the school districts. Next slide, please. So a couple things. I want to give some thought to keeping students safe in the time of COVID. And there are a number of things that we do that are stair-stepped. I want you to think about this as kind of a sliding scale. As we begin thinking about controlling disease and making a safe workplace in schools and for students, whether at home or in the school classroom, the important thing here is don't strain your eyes, try to read this chart. What you see is on the far right is red, and it harkens to, or at least relates to, the fact that when disease is transmitting in the neighborhood from person to person in your community and so forth, we have to use a lot more disease control measures to get our arms around and control the epidemic. As the rates of transmission decrease on the far left, you find that we ease off a bit, and that we don't have to be so austere about screening everybody, and because it is not circulating in our community, the rates are low, and it is either come through the community or we have high vaccination rates that have already been achieved. How can school nurses improve safety? Well, there's a couple of ways, and one is certainly stay informed of what's going on. And there's two places where particularly dear to me in terms of where to get information. I look at the CDC websites and on school safety. They are updated almost daily now, and there is information on flow diagrams on temperature screening. There is flow diagrams on managing sick children. There are questions and answers for parents and teachers alike, and it has really been built out over the last year. So that's one. And the second is, and I don't want to minimize this, is the connection with the local health department. Having been throughout the United States over the past year on COVID response, and having had a chance to look at what is at the county level and the state level in terms of information on COVID about the the status, control measures, vaccination, case rates, and so forth. I will tell you some states and communities have done an excellent job, even better than some of the national advice, because it's highly tailored to the local environment about what's going on, where to get testing, where to ask for advice, where to report cases, and so forth. So those two things, look at the national level and look at your state and local level. And I think that will drastically increase your information to carry out the important elements of your job. And last, I want to mention school-based surveillance has really been important in some diseases. Every year, we track student absenteeism, particularly during cold and flu season. We see that first as flu moves into an area. We begin to see school absenteeism. It's as regular as clockwork, and children in influenza are great sentinels about the early tripwires when we begin to see influenza move into a community. It's not always true, but it's generally true. And so we always pay close attention to monitoring in physician offices and looking at issues like school absenteeism at the beginning of the school year, at the beginning of the cold and flu season. And that would be school-based surveillance. Now, as we've looked at that over the past, say, 20 years, looking at school surveillance, we realized that probably there's more information in terms of reports from school nurses, doctors' offices who are treating students and so forth, that as we begin to integrate and have connected care, we are picking up far more cues that are able to interdict and respond to epidemics much earlier. Next slide, please. So let me talk about the proper use of temperature screening going forward. I'm really interested in some of the technologies, but I'd like to keep it practical because at heart, I'm still a family medicine physician. There are recent controversies on the effectiveness of temperature monitoring. And as I mentioned, and I want to really highlight this, that mass screening is a tried and true public health strategy. It depends on the timing of the epidemic, the nature of the epidemic, or the pathogen or the disease in question. So it's not an either or question, it's something we tailor to the situation. CDC is now recommending screening be adapted to circumstances. So what might that mean? And to me, what it means is you look at certain factors in your community to help decide how to change, loosen screening or tighten it. Those are the levels of disease in the community, hospitalizations, whether your community is actively transmitting or you're having sporadic cases. All those factors go into decisions about screening. And when it comes to children, we look at age and even to decide whether is this a disease of children or adults or everybody, and we make our decisions accordingly. Case in point, CDC recommends that screening be adapted to circumstances. There are effective temperature screening strategies, and that may not include screening everybody wholesale. It may include being guided by history, selecting certain age groups. It may require pushing screening out to home and a careful dialogue with parents and so forth to have really an effective temperature screening strategy. Also, you may want to link up other things related to that based on history. Screening tools and technology are changing. I mentioned the no-touch technologies and so forth. I will give you a story on that. If you're going to use no-touch technology, you really might want to wait a few minutes till people get their environmental exposure off. In the middle of a snowstorm in Chicago, they were screening at the hospitals on entry, and I walked in, and it was the middle of a blizzard. It was absolutely freezing outside, and my temperature was recorded as 91, which meant I probably would be in a coma, but the point being, let the patient warm up to get adequate temperature or cool down if they've been outside in 115-degree weather like we are in Phoenix right now to get a more accurate reading. So I will tell you that with technology, it's becoming easier. You still have to have view it in the context of the patient specific needs and outputs. Anyway, and last thing I want to mention, health monitoring should begin at home. All my patients that I talk to, I talk about ways, when to call, what to look for, how to screen effectively at home and determine if children are potentially contagious or need to stay home or they need to be brought to the doctor's office and so forth. That monitoring really has to start at home and to pay the most dividends. And I can't emphasize that enough. Next slide, please. So in conclusion, let me just highlight a few things and I'll wrap up. We'll take some questions and we can explore some of these avenues together. Temperature monitoring trends and equipment of the future are going to increasingly have point of care technologies. You would be amazed what's in the pipelines and what is out there in terms of looking at everything from oxygenation to pulse to temperature, and then combining them to get different ways to interpret patient outcomes and decisions about patient care, and including return to duty. Things are going to be lower cost. There's going to be a proliferation of this type of technology at a lower cost, and they'll be more available. They'll be in our workplace. These items tend to be networked, and there's a lot of ability to look at a wide range of input from patients, including children, in terms of getting network technology. It may be that your cell phone in the future may be a part of your healthcare package, and so forth. And last but not least, I want to mention privacy concerns as we begin to network and have more and more technology and looking at more and more patients, students, people in the workplace, and so forth. We have a privacy issue, and HIP is still, as these become more like patient records, then privacy concerns will become paramount. So let me just close with a few quick statements and say, well, temperature measurements, in spite of all the history and all the technology, are still important and a vital part of public health and clinical practice, management of the workplace, and our well-being in terms of effective monitoring in the future. Thank you.
Thank you, Dr. Lillibridge, for that wonderful information. It was a very informative and engaging presentation. We will now move on to our next segment of the webinar, where Dr. Hype is joining us, as you can see on the screen. And we have planned now a panel discussion where these two fine gentlemen can kind of discuss some of the issues that we're seeing in schools as far as screening, adapting to the pandemic and the way that educators are responding, and get some good information for all of you who are attending today. Dr. Hype, I believe we're going to start off with you. You had a question for Dr. Lillibridge?
I do. And first of all, Dr. Lillibridge, thank you so much. That was an outstanding presentation. I love the 2 points you began with. Staying in contact with cdc.gov and that connection to the local Department of Health. So let me take it from there. You have worked with communities throughout the globe. What do you think are some of the best practices that our schools and our districts can use to get that connection and maintain that connection with their local Department of Health?
Great question. First of all, I'd like to add that there are some really outstanding departments of health. These are people who have chosen to forego research and high pedigrees in government to work at their state and local level, and that the output they put out is just tremendous. And I think the most important thing is a close engagement between health department and the school district. This is written information, websites, linkages. And for those of you who don't look at your county health, there are county and state health departments that have daily updates of everything going on in your community. Everything from foodborne outbreaks to immunization opportunities and whatever's happening in the public health sector. It's extremely important to stay networked with that. I could give a shout out to a couple websites that I've looked at recently, one in Michigan Health Department, Chicago, have been just excellent in terms of tracking and following the COVID outbreak.
I mean, there's so much that goes on, and I love the fact that you brought that up, because all too often within our schools, we'll get the idea of, having some of those people from the outside saying, oh, that won't happen here. It's unfortunate, but guess what? The pandemic happened everywhere.
Yes, it did.
Yeah, and I think that's a difficult thing for us to remember, that part of the plan needs to include that Department of Health in what they might recommend. Now, if you don't mind, I want to take it one step further, because of course, with your presentation, my mind is kind of whirring right now as to, okay, how do we implement this with other administrators and school nurses too? And one of the things that I'd like to know your thoughts on is having our school nurses maybe set up, I guess for lack of a better term, wellness appointments, where they might continue temperature monitoring, once a quarter, once a semester with the students, just coming them in, but also then asking them how they're doing. Because one of the things that we are definitely facing too on a health issue that is fallout from the pandemic is trauma. And we want to make sure our kids are taken care of, and our faculty too, for that matter. But what do you think of that continued use of temperature monitoring, even in like a wellness visit type arrangement?
Well, I think temperature taking is part of the vital sign, the entry level into a visit usually. But let me pick up a thread that you mentioned, and let's talk about this for just a second. One is that you mentioned the word wellness, follow-up, engagement, and so forth. Wouldn't it be wonderful if we could foster these wellness visits or activities that we have, and move from a point in time where we look at a sick child or a temperature to begin looking at all the things that factor into health and well-being, behavioral, mental health, diet, nutrition. Look, schools are already involved in nutritional programs. We have issues where it comes to the forefront about immunizations and so forth. They're already involved, and why not take it a little step further and engage in some wellness activities if appropriate.
And I think that's so important. I know that, we've got some school nurses out there right now, as they're going through things, they're recognizing that they should be more of the wellness leaders. We're seeing some of this come back. Our health and physical education teachers right now are looking at social emotional learning. And that's an important thing, because that helps address the trauma, which can then help address the health of an individual. I mean, what are some of your thoughts on that, making it part of a curriculum, but a holistic curriculum?
No, I'd be all for it. All for it. And I think it's extremely important. Who would have guessed that modern medicine would be about public health nursing? You go full cycle to technologies and miniaturization and robotic surgery, and we come back and it's public health nursing is the bedrock of health and wellness. And so it's a pleasant discovery for me. That's one. It reminds me of a few things, and I have a question for you. So let me. Your background has been heavy in education and how the interplay. And I have a question I've been thinking about. We are doing lots of planning for response to health events and so forth. How do we balance that against the need for learning and so forth, so we don't overdo it, we don't end up relegating students for home study for the rest of their lives, and we have some balance in there? What's your perspective on that, Doctor?
It's interesting, because you don't want to say that the pandemic had any silver linings, but in some ways it did. It brought us to recognize different things. Take a look at what we're doing right here and right now. This used to be something, a webinar that was only done in professional ways at certain times, but we've begun to realize that now those students that maybe are out because of an illness, because of a broken leg, because of whatever, they don't lose contact with education. And so now we can begin to take a look at education and say, okay, we're not going to say, oh, it's got to be an all virtual environment. But suddenly, for me, as someone who did a lot of my administrative work in the Midwest, we used to have snow days. And the kid, I don't know who was happier, the kids or the faculty, that they had those days off. But now you don't miss the learning then. You could actually have virtual assignments that go on. And guess what? That becomes more relative to what goes on in the world beyond academics. So I see some of the things that we can do, especially on the health side, and continue it. You know, we talk about, again, diet and movement and dealing with life. That should be part of the curriculum. It's not just, I hate to say this, and I'm going to have some administrators looking cross-eyed at me. It's not just about getting a certain grade on a test. It's about what is that child going to take with them for the rest of their lives? What are those things? My goodness, hand washing. I can't tell you how many signs we'd put up in the bathrooms, outside of the bathrooms, all over the place saying, wash your hands. Well, now suddenly there's more of a realization as to what that means when you don't. And so, you know, there are some things that I see allowing us to really become a more holistic approach in helping students understand this in all of our curricula.
No, I mean, I agree. You know, we, oddly enough, you know, I had a chance to talk with Microsoft lately, and I went up there and I said, and it was a forum for educators. So 500 of us were there, and we got to be lectured by Microsoft for a day or two, hear about what is all the cutting edge technology, what's new, what's hot, what's on the horizon for learning and so forth. And one of the presentations that got me most of all was the idea that I asked them one of the questions. I said, what should I tell kids to study to work for a company like Microsoft? What degree should they get? And they said, we don't look at degrees much anymore. We look at what the student has learned and what they're able to do. And cardinal rules were health, economics, responsibility, and so forth. And they said, we can train the rest. And, you know, if you have a knack for information technology, we can train the rest. We don't necessarily need the big degree. Now, I don't want you to quote me and say college degrees are not worth anything anymore. But, I was shocked that a lot of the common lessons that you just talked about are part and parcel, incredibly of interest to industry. So there we are. So let me kind of get back to that, because you got me thinking about another question about planning for the future. You know, based on you know, your role as an educator and the interface being health and education, if you are thinking about planning for emergencies in the future and perhaps challenges, what do you see is on the horizon for us to plan for in school districts and schools, especially in the health sector? I know a lot about snow plowing and putting salt in the roads and all the other stuff, but on health planning, what do you see are challenges in the future?
So one of the things, we have to get the community at large to understand that planning for these health challenges that may come up has to, again, be something that is generalizable enough where we can adapt to whatever it is. This is not like just putting together a fire drill. You know, that's nice. You know what path you have to take and you know what steps you have to take. If we're going to do this planning correctly, again, I love the start. Get that county department of health, bring them in, talk about, okay, how do we have that open line of communication? What do we need to be looking for? I love the keeping students safe grid. I think that that's absolutely phenomenal. But now how do we make that part of our culture? And so within that planning then, you know, what happens if, you know, and to take it in that step then, so that the planning has to be kind of looking out, yet still understanding that we're not just talking about a pandemic. You know, what happens if, you know, there is a food issue that goes on, you know, from a local grocery store that we've got to deal with? What about some other issues that may come into play? What about those communities where influenza hits and hits very hard? What should we be doing? Because you're right, there might be student absenteeism, and guess what? There might be teacher absenteeism too. So what are those things we need to be looking at? But we have to do it more in an open way and understand that there may not be a simple recipe.
I got you. Well, I'm glad you mentioned Safer School Initiative. You know, I've been looking at that, and you know, I went back to it after a few months and thought about some of the components of that, and it really made sense. I'm glad you brought that up. As I think about safe space in terms of health and making you know, the school site safer, you know, I have a need to kind of tell people you've got to think about this a little more broadly. It's not whether an individual student gets to school on time and gets home and so forth. That's important, but if I'm thinking about the entire classroom or school or district, I have to begin to think about things in terms of systems, in terms of things that can be generalized and scaled to the greater good. And I really see a couple of key points there. One is planning and preparedness to manage emergencies, a wide range, not just a fire drill, but there's a whole range of things that schools have to be worried about these days and engage in planning. That planning is not as good if it's not integrated with health departments, fire, and so forth. And we can all see that now that in this new complex world we're in COVID, that we are highly interchangeable and related. The second is that health, the way I define it in terms of planning, it includes behavioral, emotional, physical wellness, campus security, and digital safety. I will tell you that all these things are incredibly important to both the physical and mental health of students, and have to be considered simultaneously as we begin looking at that. And for those of you who haven't looked at the website on Safe Schools Initiative or Safer School Initiatives, it is well worth it to take a peek. You can enroll, you can look through some of the information. They have toolkits in each of those areas to help you do some planning. And the way you use those toolkits is you simply open them up under the topic like physical wellness, look through and see what relates to your classroom, your students, your school, and what point perhaps in the epidemic response you're at, or what threat you're facing or risk you're trying to address. And it's fairly straightforward, it's fairly easy. And the result is, you know, better planning, engagement, and follow-up in response to an epidemic or pandemic or any health challenge that you might have to face.
And I want to thank you for bringing up the whole issue of mental health too, because all too often that's one of the areas health-wise that's skirted within our schools and within our communities in general. You know, everyone's been through trauma, and we need to understand that. We need to take a trauma-informed approach to everything that we're doing, and that needs to be built into our plans too. So thank you for bringing that up.
Yeah, that would be great. I think I would like to just you know, say, you know, a lot of times we look at things around the world and we say that will never happen to me. It doesn't relate to me. But I will tell you, we are so interconnected now in terms of transportation, commerce, and so forth. There really is no them and us overseas anymore. We're really integrated in ways that would never be possible in the past. And I'll give you a case in point on that. I had a chance to work on Ebola in Africa on a response. And I've done that on several occasions, and to set up Ebola treatment centers. And International Medical Corps, humanitarian organization, had one of the biggest operations the last year, simultaneous to COVID, in the Congo. So I thought, you know, and we worked in Liberia and 5-6 years ago and so forth. So about 3 years ago, I'm at home in Texas, and what's the likelihood that I'm going to respond to Ebola in Texas? Well, I tell you, for me, it was 100% because I got a call from the governor's office to go to Dallas to take a look at a hospital that had a suspected case. And ultimately, it turned out to be a positive case, and there were 2 cases of secondary transmission. So that just gives you a case in point that it's not a story, or I'm not stressing the point to be worried about Ebola. I'm just saying we are highly interconnected. You don't know what's around the corner, and that staying in touch with both CDC and your health department is really probably the single best way, I think, to kind of keep abreast of the public health and medical news that is going to affect your area.
That makes sense. You know, you're absolutely right. Too many times we're almost like ostriches, you know, oh, that won't happen here, you know, but it does, you know, and we've got to move towards that. So, and what a frightening, but yet at the same time, such a pragmatic example too. We are interconnected in ways we've never been before. So.
Yeah, we're, you know, I hate to say that you use a phrase that we hear a lot from politicians. We're learning as we go. And as technology changes and the risk changes, we are constantly providing new tools to stay ahead or to keep up with the challenges at hand.
It's a great conversation, gentlemen. I hate to interrupt you, but we are getting a little bit close to the top of the hour, and I want to make sure that we have some time for questions for the audience. Again, I appreciate your very engaging and enlightening conversation, and I am going to move into some audience questions now, if I may. A question, I think, directed for Dr. Lillibridge, speaking very specifically about thermometry. We've got someone who's written in and is asking about the different types of thermometers to be used. They mentioned specifically oral, ear, temporal, and non-contact. They are wondering, you know, when might be the most appropriate time to use them, and specifically related to accuracy, they do not feel like their thermometers are accurate sometimes. Can you give us some comments on that, please?
Yeah, thank you for the question. I'll do my best to talk about the different technologies here. For the most part, if you take out some difficulties in terms of age and cooperation of the patient and so forth, most infrared thermometry or technology that we have is pretty good. It depends on the device you have, how it's registered, how complex it is, and whether it's been validated and so forth. It turns out that there are perhaps hundreds or perhaps thousands of devices on the market simply because they're easy to manufacture, they're cheap, and many are manufactured by a lot of startups or other companies that perhaps don't do their manufacturing under the observation of FDA and so forth. But most of the reputable companies that are in the business, the big names who make medical devices and so forth, are probably your best bet, regardless of how you decide to use thermometry or infrared temperature testing. And you know, without you know, getting into naming sponsors, I will tell you the top 3 or 4 that are all equally valid. As you get down with the other hundreds of the bargain basement and the offshoot or the expired or late to the market ones, we find that effectiveness dwindles.
Great, thank you for that information. I've got a question here. I got it again, I think directed toward Dr. Lillibridge, talking about students that are being screened as they come to school. And the question refers specifically to elementary students. If they are going to do a mass screening, as you referred to earlier, would it be best to screen the student before they get on the bus in the morning or when they get to the school building itself?
Well, here's that one's easy. It's best to screen the child as close to home as possible and in the home if possible. You know, we have technology now where we can communicate with parents. Parents can communicate with the medical folks, the educators, and other people in the community in the public health department much earlier, almost instantaneously. The more we can get ownership at the home in terms of monitoring students, the better off we're going to be.
Ryan, if I can add to that too, if you don't mind.
Absolutely.
What the district wants to make sure is that, and I agree, having the students as close to home as possible is critical. What the district wants to make sure is that there is a parent or a guardian that the student can go back home to, and what is that communication that needs to happen between the two. Otherwise, you don't want to just leave a child going back to an empty home, and you want to take a look at the holistic view. So communication between the district and parents or guardians is essential with that.
Yeah, and let me add something to this that's really important, is that we get adverse weather warnings sometimes the morning of school. So that we know we can communicate. And healthcare, health information is becoming part of that currency.
Absolutely. Absolutely. It's an excellent point. A question for you, Dr. Hype. How can we navigate mental health outcomes for Head Start students and their staff in the afterglow of the pandemic?
One of the things, first of all, that's an excellent question. One of the things we want to take a look at, especially with our Head Start students, is making sure that that safety need, that security need is being met. Talk to them, work with them, recognize there's going to be some additional neediness that might be going on, and still make sure you're keeping, again, those health protocols in place. We don't need to, put the kids in partitioned areas, so to say, but what we want to do is softly, subtly reinforce washing the hands, maintaining safe social distance. It's ironic, for years and years, we told kids stay away from each other. How many times we heard, if you kids don't separate back there, those are the things that now actually have a basis, a reason for us to say, please make sure you're staying apart from each other. Let's wash our hands. Let's go in this, but start the morning with, good morning. How are you feeling today? Sometimes just asking how they're feeling. Don't be afraid to offer a compliment. I can't tell you how many times that, and teachers, this, those of you watching, a compliment you give a student might be the only compliment they get their entire week. And that's so important. So start with that foundation of looking at those beautiful little individuals as beings that you just want to make sure that their needs are being met from a safety and security wise, but we're maintaining health structures overall.
Let me add something to that. That was a beautiful overview. You got me thinking. One is that don't underestimate the ability to empower students, even at a young age, how much they pick up, how much they learn, and how much they impart back to their parents in terms of what's going on at school. I am constantly amazed and often underestimate what children are capable of doing, learning, and actually achieving. So that, and it comes to health, where they have a self-interest in the health of their health and health of their other students. So that don't underestimate the importance of empowering students to have to be stakeholders in their own health.
Excellent
That's
point.
an excellent perspective. Thank you, Dr. Lillibridge. Thank you, Dr. Hype, for your answer as well. I think that we have time for perhaps one more question here. And this is going to relate to a portion of your presentation, Dr. Lillibridge, where you talked about vaccinated populations in schools. And the question comes in asking if it is reasonable and appropriate, and I assume that this would be, of course, in coordination with the school's local health department, but is it reasonable and appropriate to screen one group of children but not another, and perhaps this relates to the age of the child and whether they are eligible to have received and been vaccinated or not?
Well, put it this way, in public health, it may be. And I can give you some examples that are broad, and I can't comment on specific situations in your school or district at this point in time, but in general, carving out the risk group, and there are some diseases where it's really small children before vaccination age, where we have most of the problems. There are other diseases that primarily go after young adults and so forth. So your strategy should hone itself to the information you have on how the disease is spreading.
Excellent. Thank you. Thank you for that information. And I think that that's all of the time that we have for today. We are getting close to the top of the hour, so I would just like to take a moment to thank you, gentlemen, for this informative discussion, for participating with us today. We really appreciate you taking the time from your day to help share this information with our audience. I wanted to remind everyone who is listening online that we will be sending out a certificate of attendance for being here today, and we will send out a link to this recorded presentation. We also, just one note, I did see a question come in about the Safer School initiatives. We will make sure that we include a link to the Safer School initiatives on your follow-up materials after the webinar.
Thank you.
And lastly, from the school health team, we appreciate you joining. You will see a survey that comes up after the webinar closes. The survey is brief, just 4 or 5 questions. We'd appreciate it if you take the time to go through those 4 or 5 questions and just let us know, what you liked today, what you might have seen, might like to have seen differently, so that we can improve these presentations going forward. And that is all we have. I'll give you gentlemen a moment to say goodbye, and then we will close the presentation.
Thank you, everyone. Hey, and Dr. Littlebridge, you were fantastic. Thank you. It was an honor to share this afternoon with you.
Well, I feel likewise. This is a mutual admiration event. Thank you for having us, and it was a pleasure to be here. And it's an important topic, and if we can move this issue a little further down the track, so be it. Thank you.
Thank you, gentlemen. Have a great day, everyone.